Hi guys, welcome back to my channel. This is Naslalis here, and today we are continuing where we left off last week or a few days ago when we did the first part of the pregnancy series video, planning for pregnancy. So today I am still answering the question, how can you prepare or plan for your pregnancy? And we will be considering I think it's number 4, 5, 6, and 7 of the things that a woman needs to consider or think about before she actually falls pregnant. So in my last video, I spoke about a woman's age. She needs to consider her age, she needs to consider her medical history, and she needs to consider her surgical history, which is the operations that she's had, and specifically the cesarean section. So today we are continuing from that discussion, and today we'll be talking about number 4, her obstetric history, which is her history or information that has to do with her previous pregnancies. We'll talk about lifestyle habits and substance use. We will talk about maintaining and gaining a healthy weight, and we will talk about the supplements that a woman can take before she falls pregnant to prepare herself for pregnancy. So now let's talk about the first thing. And before we talk about that first thing, you know the drill. Please like this video, give it a thumbs up if you enjoy it. Please subscribe to my channel and make sure you click on the notification bell so you don't miss out on any of my videos. And also please share this video so that a lot more people can be able to see it and hear and benefit from this very crucial information. So let's go on to the first thing that we'll be talking about that a woman has to consider before she falls pregnant. So a woman needs to think about her obstetric history. And as I said, a woman's obstetric history has to do with what happened and the outcomes and complications, or how her previous pregnancies were. Now, this is for someone who has been pregnant before. This does not apply to our first-time moms who are pregnant for the first time. You only have an obstetric history if you've had at least one baby before. And what do I want to talk about specifically on this topic of obstetric history? I want to mention miscarriages. A lot of women have had miscarriages, and you will see that a woman will have miscarriages consecutively in consecutive pregnancies. And this is really something that's so distressing because every woman wants to give birth to a healthy baby. But unfortunately, some pregnancies are short-lived. They are cut short and there's no baby that is born at the end of the pregnancy. So if you have had a miscarriage, what can you do to try and increase the chances of you having a more successful pregnancy in the future? We go back to that point of timing of pregnancy. And there are quite a few reasons that may cause a woman to have miscarriages. Things like chromosomal abnormalities, which is a problem of the genes that the baby forms, or the genes that the baby uses to form. Sometimes the cells in the body or the genes that come from both the parents, they don't come and connect in a proper way that will result in healthy cells. You'll find that there'll be some abnormalities, and those babies can now end up having chromosomal abnormalities. And one of the most important chromosomal abnormality that has been found to result in miscarriages is that of trisomy 21. So you will find that these women will have miscarriages in their pregnancies, because that's something that's constant and that's there. And then they've also found that your age can also affect the likelihood of you having a miscarriage. And as I mentioned, I think in the first part of this video series, that our women that are more than 37 years of age are prone to having miscarriages. And our women who have a body mass index or BMI of more than 25, which is our women in the overweight range and obese range, they have also been found to have a higher likelihood of having miscarriages. BMI we're going to talk about later on in this video, and I'm going to explain that further. So these are the things that have been found to cause miscarriages in most women. And if you've had a miscarriage before, you do need to talk with your healthcare provider or practitioner that helped you throughout the first miscarriage to try and find out what caused the miscarriages. See if it's something that can be carried over to a next or following pregnancy, so that you can increase the likelihood of, or the chances of, you having a more successful pregnancy. And also timing. If you've had a miscarriage in 2018 and you fall pregnant again in 2019 and you have another miscarriage, perhaps it would be good to sit down, give your body some time to heal, and actually try and find the root cause of the miscarriages before you plan on falling pregnant again. Because this is something that's so unfortunate. I've seen it happen a lot of times, where you have women that are so desperate to have babies, they will fall pregnant, they have a miscarriage this year, and immediately after having that miscarriage they try conceiving again and they do fall pregnant, but you find that the next pregnancy also does not make it through. And you'll find that the mental effects that might have on the woman, because the miscarriages, it's such a traumatic experience. So I've really seen those cases and they're really just horrible to witness. And so that's why I think that it's really important for a woman to give herself time, especially if you've had miscarriages before. Give yourself time, ensure that you know what went wrong in your previous pregnancies. Discuss with your doctors or your nurses to figure out what to do going forward to try and prevent the reoccurrence of the miscarriages. Okay. So another thing that a woman needs to think about as well with regards to her previous pregnancies is, were there any complications in the previous pregnancies? Such as any medical conditions that the woman had in relation to pregnancy. Things like hypertension in pregnancy, diabetes in pregnancy. Did you have to have a Caesar in your previous pregnancy, maybe because your baby was big, or the passage of the baby to come out as you deliver naturally was not small enough? Might you have to have another cesarean section again in your next pregnancy? Those are things that you need to think about, because if you had high blood pressure in a previous pregnancy, the chances of you having high blood pressure again in your next pregnancy are arguably high. So you do need to think about those things. And also, if you have had a cesarean section in your previous pregnancy, for example, if you've had one cesarean section, you do have the option to give birth naturally in your following pregnancy. That is, if you would like to fall pregnant, or if you would like to give birth naturally in your following pregnancy. So however, you do need to give your uterus or your womb time to heal. As I mentioned before, it's advisable to fall pregnant again at least 18 months after having a cesarean section. That's if you would like to give birth naturally. And another thing that a woman has to keep in mind is that the more operations or cesarean sections that you have, the higher the risk of you having complications such as uterine rupture in your next pregnancies. So for example, if you have already had 3 cesarean sections, maybe it might not be a good idea for you to fall pregnant again a 4th time and have a 4th operation, because the more pregnancies you have and the more operations you have, the more risk the more the risk increases for you to have things like uterine rupture in your following pregnancy. So it's very important to think about your obstetric history. Obviously, when you do fall pregnant, you will discuss all of this, and depending on how many complications you had in your previous pregnancies, then you will be classified as high risk, or then you will be attending at the hospital to be monitored closely. But it is very important to think about these things, because you might find that depending on how your obstetric history was in your previous pregnancies, the likelihood of you having complications again might be too high, and it might be better to put off falling pregnant. So the next thing that I want to talk about is lifestyle and substance use before you are pregnant. For example, if you are smoking, if you drink alcohol, if you use any drugs, illegal drugs or over-the-counter drugs, before you fall pregnant, you do need to make some changes in your life. For example, things like smoking and alcohol, they have found to result in babies with intellectual disabilities. For example, with alcohol, babies born to mothers who are actively drinking throughout their pregnancy, those babies have been found to have fetal alcohol syndrome, which can result in the baby having intellectual difficulties or difficulties at school when the child goes to school later on in life. Those women have also been found to have more miscarriages. They've been found to give birth to smaller babies, low birth weight. They have been found to give birth preterm, which is before time. So again, I've mentioned this previously. You don't want your baby to have to stay in hospital after you give birth, or be small at birth, because the weight that the baby is born with, it actually matters. It actually helps to determine how the child will grow, and also how the individual will grow as an adult. So it's very important to think about these things. They can have detrimental effects. Also, people who smoke or use drugs or use alcohol when they are pregnant, they can also give birth to stillborns, which is also something that's very traumatic. So definitely, if you are having problems with substance use, you're having an alcohol problem, or you're finding it difficult to stop smoking, then it would be advisable for you to start attending support groups and really try and stop smoking or stop drinking before you fall pregnant, to avoid having some of these problems. As same goes with if you are taking over-the-counter medicines, you need to ensure that those medicines will not affect your baby, and before you start trying to conceive, you stop taking those medications, because some over-the-counter medications, even medications that you are getting from your clinic, can affect the baby while the baby is still growing, especially if you are pregnant. I will make an example of one of the drugs that we use for HIV in women who are HIV positive. That drug is called dolutegravir. Dolutegravir has been found to have some effect on a baby's spine as the baby is still developing in the womb of her mother in the first 6 weeks of pregnancy. So with this drug, if a woman intends to fall pregnant, we wouldn't put this woman on dolutegravir because it has those effects, and we would rather put her on another ARV. If the woman would like to fall pregnant, we ensure that we will need a woman to actually tell us beforehand, before she actually falls pregnant, that she wants to fall pregnant or intends to fall pregnant. Then we would stop her on this medication, at least for the first 6 weeks of the pregnancy, so that the baby's spine can form, because this particular drug, it affects the baby's spine and can cause abnormalities in the baby's spine. So we would really like the women who are on this type of ARV to plan to fall pregnant, so that they can stop this medication on time. So if you fall pregnant or are planning, most people, when they are pregnant, they don't know that they are pregnant when they are less than 6 weeks, because 6 weeks, it's a month and 2 weeks. And most women do not know by this time that they are pregnant. So it's very important that women actually plan, especially if they're on any medication, because a lot of medications have not been found to be safe for use during pregnancy. So whichever medications you are taking over the counter, even prescribed medication, you need to discuss with your nurse or your doctor and ensure that they won't affect the baby throughout your pregnancy or cause any abnormalities in the baby once the baby is born. And then I also want to talk about maintaining and gaining or reaching and maintaining a healthy weight. So in order to classify a healthy weight, I will be talking about BMI. BMI is a measure that is used, it's used to measure body fat in individuals. And there are a lot of controversies with BMI, but I won't get into them right now. BMI is still a measure that is very much convenient for health professionals to use, especially in our consultation rooms, because it's non-invasive and we can get an answer very quickly on the spot. So it is something that we still use, even though there are some limitations to it. And obviously we would have to use it in conjunction with other measures and use our clinical judgment to actually determine whether a woman is obese, overweight, or within the normal range of BMI or underweight. So BMI has different categories. The first category is underweight. So if you have a BMI of less than 18.5, it means you are underweight. If your BMI falls between 18.5 upwards and 24.9, then you are in the normal category of a healthy weight. And then if your BMI is between 25 to 29.9, you are overweight, and if it's above 30, you are obese. Our BMIs of less than 18.5, which is our underweight, it's our women that have been found to be giving birth to smaller than normal babies, our low birth weight babies, giving to our preterm deliveries, having intrauterine growth restriction, meaning that the baby does not grow as well as the baby should while in the mom's womb. And then our BMI of more than 25, which is our overweight, and our obese women have been found to have your pregnancy-related hypertensive disorders, your high blood pressure in pregnancy, your diabetes in pregnancy. Those women have more instrumental deliveries, or they need to be assisted when they're giving birth vaginally because they give birth to bigger babies. They have to have more operations because their babies are too big and they struggle with delivering naturally. So things like that. They even need to be induced at times. So there's a lot of complications that are associated with that. So that's why before you actually fall pregnant, you do need to look at where you are, your weight, your BMI, where do you fall in this whole category, and if needs be, make some changes to try and get to a normal BMI. Of course, you would have to discuss this with your nurse or your doctor. You might have to do some changes, lifestyle modification in physical activity, for example, in your diet, to try and maintain a healthy weight. But it is important for people to actually do consider this thing to avoid some of those complications that have to do with BMI and your weight. And then lastly, I want to talk about supplements. So there are some supplements that a woman can take before she falls pregnant in order to prepare for pregnancy. And I'll be talking about 3 supplements: folic acid, ferrous, in other words, also known as iron tablets, and calcium. Folic acid will help with preventing one of the types of anemia that a woman can have, which is folic acid deficiency anemia. Now, anemia is when you have a low red blood cell count. When you have a low red blood cell count, people who are anemic, they are usually very pale, and if they bleed, they can lose a lot of blood quite easily than people who have a normal red blood count. So those are the people that end up having to have blood transfusions. So folic acid is going to help you to increase your red blood cells if you have folic acid deficiency anemia and you are not getting enough folic acid from your diet. Also, ferrous sulfate tablets or iron tablets, as I already said. They will also help you to increase your red blood cells if you do have an anemia, which is called iron deficiency anemia, meaning that you also are not getting enough iron in your diet. So those supplements will help you to increase your blood. And then folic acid will also help in the development of your baby's spine. So you can take that before you conceive and also during the first 3 months of your pregnancy. What about calcium? Calcium will help to prevent the complications that are associated with hypertension or high blood pressure in pregnancy. So it's great to take these supplements. You can take them before you fall pregnant, you can take them throughout your pregnancy, and some of them, like your ferrous or your iron tablets and your folic, you can continue to take them after you after you deliver, because when you deliver you will lose a lot of blood, and to replenish all those red blood cells for some time after you give birth, you can continue to take those supplements. So those are supplements that women can take. So yeah, guys, I know this video has been filled with so much information, it's been packed with so much information, but I was really motivated to do this because I really felt like this is very important information for every woman to know. I have seen the complications that women have to go throughout their pregnancy and all the problems that is caused by not planning enough. So yeah, that's why I really feel so strongly about planning. Pregnancy is a beautiful thing, and you really want to increase your chances of having a successful and happy pregnancy journey. So yeah, that's my 2 cents, guys. I hope that you really learned a lot from this video, and if you did enjoy this video and you felt that you've learned a lot, please give it a thumbs up. Please subscribe to my channel. Don't forget to subscribe, and please do share my videos so that a lot other women out there who are planning to fall pregnant, who are pregnant, can be able to join my channel and be able to see my videos and go on the pregnancy journey with Nurse Hlalis. Thank you again, guys, for watching. Thank you so much for all the wonderful support. I truly appreciate it. I love you all so much, and see you next time on my next video on the importance of booking early when you are pregnant.